Hi students, this is Ms. Pizzacreta, your instructor. We are going to be looking at some of the treatment modalities for anxiety disorders. One of the first defenses that we have in terms of treating anxiety in a client would be medication. The prescribing of anxiolytics, these are drugs that reduce anxiety, is a typical frontline measure to address an anxiety disorder. Things like benzodiazepines, which would include Valium and Xanax. These things are particularly helpful because they do help a client to sleep. As I've mentioned previously, one of the things that can happen with anxiety disorders is that it can be exacerbated and exaggerated by a lack of sleep, and sometimes it can be very difficult to tease apart whether or not it is the anxiety that's causing the sleep disorder or the sleep disorder that's causing the anxiety. Another medication that is used are antidepressants, things like tricyclics, SSRIs, and SNRIs. We do know that there's a fair amount of comorbidity between anxiety disorders and depression, and we do find that by prescribing antidepressants, you can by extension get alleviation of anxiety. Are there any concerns? Absolutely. There are side effects that need to be considered. It can be problematic with continuing medication. So this has been one of the big criticisms that's been levied by the director of the NIMH toward the psychological community and psychiatric community, which is that the research really needs to address, well, what does it mean to prescribe medication? What kind of paradigm are we going to use in terms of time frame? Because is a person going to be on that medication forever? Are they only going to be on that medication for a short period of time? How do we transition them off the medication? And so on. And he's really asked us as a community, as a research community, to think about how it is that these medications work. We need to find out more information and to think through what it means to take them and how long we are supposed to be taking them. Slide 2. So what are some psychological treatments of phobias? I'm going to go ahead and start with phobias because they are our most common anxiety disorder that we face as clinicians. So if your plan is to work as a clinician or work within a mental health institution, often when it comes to anxiety disorders, we're going to be facing those individuals who are struggling with phobias. One behavioral technique is just simply by using exposure. Basically, you are exposing that individual to the feared object or the feared situation. It generally happens in life, and we find that exposure is more effective than systematic desensitization. So in other words, you are putting that person in the presence of their feared object, whether that be a spider or a snake, and you're going to be doing that possibly even more than once until they get over that phobia. Social anxiety disorder, same treatment, exposure. So you're having them doing role playing or small group interaction. If their social anxiety disorder is fear of speaking in front of others, you might have them go ahead and try that in front of a very small group of people first. If their social anxiety is eating in front of people or meeting new people, you might work on some social skills training. It forces them to reduce the use of safety behaviors. In other words, it's causing them to have to confront what it is that they are fearing. Another way to treat social anxiety is through cognitive therapy. And basically, when I use that word cognitive, we're really talking about the ways that we think, helping clients restructure those maladaptive thought patterns. And Clark did some really interesting research and found that cognitive therapy can be very effective, even more so than medication or exposure. Slide 3. So what about those individuals who struggle with panic attacks? What treatment options do we have for them? They can engage in what's called panic control therapy or PCT. This is the use of coping strategy to control symptoms. So in other words, when a client starts to feel those symptoms coming on, they're starting to engage in rumination, they're thinking about the same things over and over again, they're starting to feel some of those physiological symptoms, the racing heart. What we do is we teach them coping strategy or controls or ways to help them control those symptoms. So different relaxation techniques, deep breathing, that will help them gain mastery over those physiological symptoms. What's very good about PCT is that the benefits seem to be maintained after the treatment ends. So once that client learns those techniques, they take those techniques and they bring them into the future and they continue to utilize them. Slide 4. What about for generalized anxiety disorder? What psychological treatments do we have? Again, as I mentioned earlier, relaxation training, learning those deep breathing techniques, learning techniques to help you be able to relax in the face of anxiety, and also some cognitive behavioral methods, challenging and modifying those negative thoughts, increasing the ability to tolerate uncertainty. One of the underlying issues with GAD is just this difficulty that the client seems to have with the unexpected, or what might happen, and getting them to understand that there's always going to be a certain level of uncertainty in the future. You cannot control everything. Setting up worried, scheduled times. So telling an individual, okay, you can have a 30-minute worry session in the morning and a 30-minute worry session right after dinner. And these are your time periods where you're going to sit down and you're going to worry and ruminate and think about all the things that might happen. And when that time is up, that's it. And finally, another cognitive behavioral method would be working on getting that client to focus in on the present moment. As I said before, part of the challenge with treating individuals that have GAD is this fixation or focusing on the future and this anticipation that something negative might happen. And getting that individual to live in the present, to enjoy the moment, to be able to fully experience what they're engaging in and what that moment that they're living in can really, really help in terms of alleviating those symptoms.